Good afternoon, everyone. I'm Brittany Hope. We have been hearing from so many of you that you have questions about vaccinations here in New Mexico. So we wanted to take your questions straight to the Secretary of the Department of Health. Dr. Tracy Collins is live with us now. Dr. Collins, thank you so much for spending part of your lunch hour with us today. We know you are busy. Before we dive in, we do want to take a look at where vaccinations stand as of now in New Mexico. So hopefully we'll put these numbers here on your screen. The state has received 454,350 doses so far, and 450,299 of them have been given out, which is just an incredible rate. There are your numbers there on your screen. You can see doses received and doses administered. Dr. Collins, our viewers have been writing to us questions to ask you today. Many of them are about the vaccine and when the opportunity to actually get that vaccine opens up for more people. So right now we are in phase 1A and part of phase 1B. Gladys Ross asked us on Facebook, when will group 1C start vaccines? And I would also add, when will the rest of phase 1B open up?
So the rest of phase 1B, and thank you for having me and thank you for the questions. So when will group 1C start for vaccines and when will the rest of phase 1B be open? It really is a matter of available doses. So right now, when you think about the number of people who are in that phase 1A and the first two subgroups of 1B, it's about 800,000. So if we're receiving about 70,000 doses a week, we have to think that's going to take several weeks out to get through those groups. However, the good news is we're hoping to see more vaccine coming in the next few weeks. So hopefully it won't take as long, but I cannot give you a specific date because I don't know the exact numbers of how many doses of vaccine we'll get moving forward.
Got it. And when will we have a better idea of when we could see those doses come in the next few weeks?
Well, there are a couple of factors. The Biden administration is rolling out incremental increases in how much states are getting each week. And then also we're going to be hearing about the new vaccine in the next 2 to 3 weeks. So we should have more information for you at least by early March, if not mid-March.
Wonderful. Thank you so much. Following up on that, we did receive an email from a woman who told us a little bit about her and her partner. They're both 70 and 71 years old. They're both Black women with asthma, hypertension, and obesity concerns. She believes both are in phase 1B, the current phase that's getting vaccines right now, but they haven't been contacted yet to actually get that vaccine. She wants to know from you how race is being taken into consideration when deciding who is getting the vaccine.
Yes, and thank you for that question. So when we think about the current groups, one of the groups is 75 or older, and then 16 or older with at least one chronic condition. So as we think about race, what we're looking at is we're reevaluating how we roll out vaccine based on equity and looking at social vulnerability and looking at where are the areas hardest hit and where are the areas that are most vulnerable to COVID. And then looking forward to roll out a subset of our vaccine doses to those most vulnerable. And within those most vulnerable, we are taking into account race and ethnicity.
Our next question is from Cynthia Leba. She wants to know, are there drive-through clinics to get vaccines here in Albuquerque? The next question is, do you need an appointment for them if they do exist? Cynthia says she has limited mobility and a drive-through clinic would work best for her.
Yes, and so we are rolling out approaches to delivering the vaccine that make it not only equitable, but easier for everyone to reach. So yes, there are those that are walk-ups, but we are creating these sort of pods that we have in place already. But then also we're looking at, in the future, mobile vans to go around so that people don't have to drive as far. So those are things that are in the works for the future.
Okay, great. And Secretary Collins, we know the governor met with President Biden last week and spoke about the need for better information about how many doses of the vaccine the state is getting and when. We just talked about this. The department said this week the state would get 61,000 doses. So is the state getting enough supply right now? And has the information from the federal government gotten better? A repeated concern here, definitely.
We need more vaccine. So the supply is getting better, but it's not where we need to be. We need a lot more vaccine. We are seeing a lot more transparency and things are getting better with the new administration.
Got it. And a repeated concern here seems to be that other states are using local pharmacies while New Mexico so far is not. Janet Whitted asks, when will our retail pharmacies like Walgreens and CVS be administering the COVID vaccine?
Well, they already are administering it. Keep in mind that there are allocations coming to our Department of Health, and then a subset have gone out to take care of long-term care facilities. And we've just about completed those second rounds of shots in long-term care facilities. And now there's a federal pharmacy partnership where they're going to be getting their own doses, not pulling from our supply, but getting their own doses directly from the feds. And then they will be administering vaccines according to our provider guidance and working with our portal. So pharmacies are, in fact, already receiving doses, and will be receiving more.
Oh, that's great. So those doses will be separate from the doses the state itself is getting. So it'll be two completely different pools of vaccine.
That's correct.
Great. Dr. Collins, many people in New Mexico have asked similar questions about their loved ones as well, who have not been notified that it's their turn for the vaccine, while others, often without medical conditions or working as first responders, have. Our viewer John Spalding put it this way. He says, I have seen two of my friends, both in their 50s, get their vaccines. My in-laws, who are 77 and 87, have not. He wants to know why.
And I'm sorry for that. Keep in mind, there's a large group of people, even in those subgroups. So if we look at the healthcare workers, we're still getting through that group, that 1A. And then if we look at those who are 75 or older, we really need to focus on that group and get them vaccinated. But then the next group are those who are 16 with a chronic condition. And so if you think about that large pool and trying to get everyone in, and then as vaccine doses are available, we are pushing people to appointments. So we're really doing the job of trying to get those most vulnerable and who are most at risk to appointments. However, if a site is trying to reach someone and has vaccine doses that are about to expire, they really have to move quickly down the list. And so sometimes these stories about how someone younger got the vaccine was not because we pushed them to the appointment, it was because vaccine doses were about to expire and they were readily available to receive those doses.
Right. And in those cases, that's something we've heard not only in New Mexico, but across the nation, when at the end of the day, people haven't showed up for their appointments and they do have those extra doses, how are those people chosen who can get those last minute vaccines? Is it a free-for-all? Is it folks who are supposed to get the vaccine the same week? I mean, how is that system working?
Well, the system itself is evolving and we're improving it. It was initially more with the providers actually dictating who could they reach, looking at our provider guidance and quickly going down that list to reach these people. And now what we're doing is we're making sure that those most vulnerable, those 75 plus or those with a chronic condition, as well as healthcare personnel, that we actually, if they are on the list, they've been reached, but we've not been able to get vaccine doses in their arms, that we are creating a wait list for them to move them forward quickly so that we can try and get them vaccinated knowing that they're vulnerable and have been waiting.
Okay. And vaccines for teachers, of course, is another often repeated question from our viewers. Just last night, APS announced they are continuing virtual learning the entire semester. We know other districts are going back to that hybrid. Patrick Guerin wants to know why teachers weren't given the opportunity to get vaccinated before the governor announced schools could open. We do want to remind people watching, Secretary, about how to register for the vaccine. Remember, you can register online, vaccinenm.org, or by calling 1-855-600-3453. But again, if we can go back to vaccinations for teachers.
Yes, and certainly teachers are very important, as well as other frontline essential workers. The provider guidance that we have in place is based on who's at greatest risk for morbidity and mortality from this vaccine, which are those 75 or older and those with a chronic condition. When we look at the data for schools reopening, using best practices can protect our teachers. They do not have to be vaccinated. That said, having educators in my family, we want to get them vaccinated as soon as possible. So we're looking at how we can, as we get more doses, open up sooner the next group to pull in teachers. So we are working on that, but right now it's focusing on the groups that we currently have prioritized: healthcare personnel, 75 or older, and those with a chronic condition. Keep in mind, teachers don't exist in isolation. Some of them may actually be 75 or older, as well as have a chronic condition.
Right. And as we continue, Secretary, to get more of those doses, could teachers be bumped up in the list, especially now as districts are going back to school as we're live right now? Is that a possibility?
It's certainly something to actually consider, moving teachers who have a chronic condition, trying to make sure we reach out to them to get them vaccinated. Absolutely, we're looking at that.
Wonderful. I do want to go back on how to sign up for the vaccine. Again, you can call 1-855-600-3453. That number is on your screen. You want to press 0, then 4. If you have a computer or internet access, you can go to vaccinenm.org. Dr. Collins, we know that phone number was added because a lot of people don't have internet or don't know how to use it. Do you know how many people are registering for the vaccine by using that phone number?
You know, it's a good question. I don't have an exact number for you for the number who are using that number to register. A lot of use of the word number there. But what I would say is that it has helped with those who have not been able to use the internet or need more assistance. And so I would venture to say that it's probably a 25% subset of the total number, but that is a guess on my part. I've not looked at that data specifically.
Donna Flom has questions about the process after you register for the vaccine, and we were just talking about this. So she asks, how do you set up an appointment to get vaccinated after you get registered, and how do you know where those vaccines are actually being given out?
So once you've gone online and registered, or you've had the information input for you, we will reach out to you when you have an appointment. And then the steps to take at that point will be spelled out to you when we communicate with you. So there are steps. The only thing we're asking you to do is to put your information into our system, complete your profile, and then wait to hear from us regarding your appointment.
Wonderful. And we talked a little bit about this earlier, about how the state is choosing exactly who gets the vaccine in terms of the standby. But for the actual process, Marianne Castillo del Muro is asking, out of the people that qualify for the vaccine, how does the state decide who is getting vaccinated next? Is it a lottery system? Is it alphabetical? Is it first come, first serve? How is that process working?
So let's say we have two people who are 76 years of age and are both up for the vaccine, and we have one dose. We randomize them. So we are randomizing who's getting that vaccine, which is why it's so important to have vaccine providers use our registration app.
Dr. Collins, so many people are spending time looking at the information provided by the state about vaccines and infections, and we get a lot of questions about the data of infection rates in different counties. Sue Palmer says she looked at the dashboard and saw that Union County is leading the way right now, but Sandoval and Bernalillo counties have fewer vaccines per 100 people. Does this mean fewer doses are getting to these larger counties?
So it's multiple factors there. When we initially rolled out the vaccine and trying to capture healthcare providers, we were looking at these large healthcare systems and getting shots in arms. As we're continually evaluating and looking at the inequities across the state, with certain counties getting more than others, now we're beginning to factor in, who is most vulnerable, who needs to get the vaccines, and we're also wanting to make sure we get booster doses into arms. I want to take a moment and encourage people, please, if you've gotten your first shot, do go back and get your second shot. It's very important to complete this immunization process. So as we're thinking about, a lot of shots went into our primer doses in arms, we really had to get caught up to make sure we had booster doses in arms. And so what's happened recently is that we had slowed down a bit the number of doses going to these larger entities so that we could make sure everyone got caught up on booster doses. So that's one factor. And the next factor will be making sure that we do this equitably and that it's not just about the size, it's also about how many vulnerable people are in a given county or a census tract within a county, and addressing getting doses to those places, and also making sure we have vaccine providers throughout the state and making sure there are doses going out throughout the state. So there are multiple factors. Finally, I want to add that initially, when we looked at the county level data and what was reported initially, it was based on the address of the vaccine provider. or the entity providing your vaccine. We then went back and updated it to reflect the address of the person who received the vaccine. So that also adjusted the numbers.
Dr. Collins, as we talk about phrases like equity, accessibility also comes to mind, and that's huge for our rural areas. Right now, the Pfizer and Moderna vaccines are being given out statewide. Dr. Anthony Fauci has indicated if the Johnson & Johnson vaccine is approved, it could be a game changer for rural areas because it's just one dose and it doesn't have those temperature storage restrictions. So does the state have a say in what brand of vaccine we get? And do you think the Johnson & Johnson vaccine would benefit rural areas of New Mexico?
I do think the Johnson & Johnson vaccine would benefit rural areas and persons who cannot get out of the house or who are more transient. So it's really about the logistics of getting the shots in arms. And storage is so much more seamless with Johnson & Johnson's. So yes, I agree with Dr. Fauci that we would definitely want to look to the remote areas. We'd also want to look to populations that don't stay at one place for very long, that we can get this one shot in their arm, one shot and done. So that would be ideal. And as we look to getting more vaccine doses, and once we see the approval of Johnson & Johnson, we want to balance Pfizer and Moderna with Johnson & Johnson and look around the state to say, where does it make the most sense to provide this vaccine versus the others?
And these are questions about how the vaccine is impacting case numbers in New Mexico. We know a lot of our viewers watch the dashboard really closely that your department has created. Alinda Studeris says, why are deaths so high when cases and hospitalizations are dropping and vaccines are now being administered? She wants to know the cause.
So keep in mind that the sort of path or cadence for cases, hospitalizations, and death, there's a lag behind cases before you'll see death. So we're still seeing the aftermaths of our cases. Same thing applies with hospitalizations. Fortunately, we're seeing a decrease in cases, but there's a lag in what we're going to see as far as the impact on deaths. And so it's one thing to keep in mind that don't all happen at the same time.
We heard from a woman in DeBaca County about how case rates are being calculated. So another question about that database in the rural areas. She says in the last 2-week cycle, DeBaca County has 7 new positive cases. And there's only a population of 1,400 in that county. So she wants to know why they are being calculated as if they also have 100,000 people, that rate there.
Yeah, so keep in mind, there are cases and then there's testing. When we look at cases, that 8 per 100,000 in a county as a metric, we're looking at the cases in that county, but divided by that county's population. And then we also look at, it's a 14-day case rate. So we're looking at the average, and then we multiply that by 100,000. For the test, what we're looking at is just one positive test divided by all tests within a 14-day period, removing duplicates. So if you've already been positive, we don't count you twice, we count you once. So that does that number does look at both numbers. We're looking at population size for a given county. And then we're also looking at test and the rate of testing, which is why we encourage everyone to be really looking at testing and continuing with testing, even as we roll out the vaccine. It's very important.
And that's a fabulous follow-up question as well. So right now the state is only counting one positive test if someone tests positive multiple times?
So at this time, yes, because we're looking at it's the time frame. When you're looking at rates, you're looking at a time frame. And so we're looking at a 14-day time frame. But keep in mind, we're also working with labs to make sure we're getting their results in a timely fashion, and that the results that are sent to us really reflect the last 14 days that influence that red, yellow, green.
Okay. All right, Dr. Collins, Susan Martinez has a treatment concern, so kind of switching gears here. She says, why aren't doctors and hospitals giving people who have tested positive that are not asymptomatic medicine right away so they don't get infected and end up in the hospital and eventually pass away?
So I want to make sure I understand the question. So those who are not or who are asymptomatic?
Those who are not asymptomatic. So those who are in the hospital, who are feeling those symptoms, why aren't they receiving certain medications right away? That was what Susan Martinez was asking us.
Right. So one of the indications for, like, as an example, monoclonal antibodies
Hmm.
is really to keep you out of the hospital. So once you're in the hospital, there are options like remdesivir and other treatments that are definitely offered. But those monoclonal antibody treatments, there are specific criteria for how we use them and who we use them on. And that really is used to keep you out of the hospital. So when you're thinking about being symptomatic, if you've not been admitted and you meet criteria as far as having a severe condition, you're 12 years of age or older, you're eligible for the monoclonal antibodies. Once you're in the hospital, these antivirals, remdesivir, are things that we're looking at, prednisone, depending on your presentation. So we have to follow clear criteria and guidelines for how we use these medications.
Okay. Now, moving away from treatment and back to vaccines, Charlene Jaramillo, excuse me, can you take the vaccine if you're on antibiotics and steroids? She's asking about concerns getting that second dose specifically.
Yes. What I want to encourage you is that you definitely can take the vaccine. And so it's really, we just want to look at how you're feeling that day and make sure we're not compounding any current illness. Not that the vaccine is going to do that, but we want you to be as healthy as possible before we give you the vaccine. And so typically, as we wait between doses, we're looking to, to wait to make sure your immune system can respond appropriately. And that's why we have that at least 21, 28-day window between Pfizer and Moderna between the first and second doses. So when you go for your vaccine, you're asked a series of questions, and that's just to make sure that we keep you safe. And we're also making sure that we avoid any sort of reaction to the vaccine. But it's a little bit independent of being on antibiotics. That's not a contraindication. And being on steroids is not a contraindication.
Another similar question about the nitty-gritty of that second dose. So Angela Bussell-Slaughton is asking, if I have had one COVID vaccine, but then I got COVID shortly after, do I still need to get that second dose? Am I now immune?
We cannot rely on your body's reaction to infection to suffice for a good immune response to COVID. So yes, once you clear, so if you had your first dose, you have COVID and infection, once you're beyond that infection, you do need that second dose to really mount an appropriate immune response.
Dr. Collins, our next question really speaks to a larger issue. It's from Jackie Von Lowe. This is what she's asking. Should someone with scleroderma taking immune suppressants get the vaccine?
Yes, and yes. And the issue is that, yes, your body's response to the vaccine, the amount of immunogenicity that you might mount may not be as great as someone who's not an immunosuppressant, but you definitely want to get the vaccine to reduce your chance for morbidity and mortality from COVID.
And to follow up from that, doctor, are there medicines or conditions that do not pair well with the vaccine right now?
We don't have any evidence of any conditions or medicines that don't pair well. We don't want to give you more than one vaccine at a time. So we would not give you the flu vaccine while you're getting the COVID vaccine. But as far as contraindications in general, no.
Okay. And backing away a little bit from the treatment and the vaccines, let's go to enforcement. Our viewer David Smith wants to know, is anyone monitoring enforcement of masks while not eating or drinking out in public? He says there seems to be a misunderstanding about the mask requirement concerning indoor versus outdoor, especially as the state is reopening. If you could clear that up for him.
You need to wear your mask when you're walking into the restaurant, and when you're eating and drinking, you take the mask off. When you're ready to leave, you put the mask back on, and then you can exit. But that's whether you're indoor or outdoor, masks are needed.
And for those just joining, we'll head back now to vaccine questions. Our viewer Peggy Burnett is now asking, when will New Mexicans 65 and older start vaccinating? Every state, she says, in the area is vaccinating those 65 and older, so why aren't we? She also says the hospitals say vaccinating those 70 and older could take months. She's concerned.
Right, and you have to look at the number of chronic conditions by state, and basically how sick of a state are we when it comes to chronic conditions and not just age. A large proportion of people who are 60 and older in this state have at least one chronic condition. So we're largely capturing those people with our current guidelines, So for those 75 or older or 16 or older with a chronic condition, we're getting a large subset of those who are in the age groups that she referenced.
Dr. Collins, a viewer named Alipio Mondragon is sharing this story, saying, my 84-year-old father received his notification, and when he showed up at the pharmacy for his appointment, he was turned away because no vaccines had been delivered to that site. He's now asking you, are these issues being corrected?
I'm sorry for that experience, and yes, these issues are being addressed and corrected.
Wonderful. Following up, Dr. Collins, looking at our case rates, this is something else that viewers are curious about. Our case rates are going down, hospitalizations are going down, the state is opening up. Do you have any words of wisdom or any warnings for anyone who's watching? We hear a lot of folks say they should be taking cautious optimism right now when you look at our numbers.
I would follow up and say absolutely that we should be optimistic but cautious about it, that we should continue best practices, wearing a mask, washing your hands, staying at home, and socially distancing. And so what I would encourage you is that the numbers do look good, but we've got some things on the horizon with these strains, strains that are the mutations of the COVID virus. And so we have to be careful because we're still learning more about how effective the vaccines are going to be against these new strains of COVID. So yes, there's hope. It's positive. Cases are trending down. And we know that the impact of receiving the vaccine has impacted our cases by about 20%, reducing them. And so we're hoping that that happens moving forward, but we can't let our guards down. We have to maintain best COVID practices moving forward.
Dr. Collins, is there anything else you want to add before we wrap up, whether it's vaccine, testing, anything else you want New Mexicans to know who are watching right now?
I want to encourage you that things are moving in the right direction as far as getting more doses, that I want to encourage you to continue with the testing. And I want to encourage you that there is hope coming. It's just taking time. And so as we move forward, more people will get vaccinated, and please register for your vaccine and let us know about issues so that we can correct them once we hear about them. And thank you.
Wonderful. Well, Dr. Collins, thank you so much for your time today and bringing more clarity to our viewers and taking part of your lunch today to be with us.